Greetings, ladies and gentlemen. Welcome to Introductory Principles in Pharmacology. And this is the first part of pharmacology as a course. And the objectives are that these principles should be able to help you understand how drugs are studied. And so you are encouraged to pay attention to these principles so that it will be easier for you to understand how we study drugs. So it's a very important course, and you're encouraged to pay extra attention and work hard. So the objectives of this lecture is that you should be able to define what pharmacology is, should be able to explain the different ways we study drugs in terms of highlighting the branches of pharmacology, and then you go into detail explaining each of the branches, how it helps us to understand drugs. So that's the objective of this introductory session for pharmacology. So quickly, what you will realize is that most of the medical literature was written either in Latin or Greek. And so we borrow a lot of words, even in pharmacy training, from Greek and Latin. So pharmacology originates from pharmakon, a Greek word that literally translates into everything to do with drugs. And logos, you realize it is basically telling us about the study, the knowledge, the teaching of anything. So pharmacology basically is the knowledge about drugs. So technically speaking, pharmacology is a science that helps us to study how different chemical substances interact with the body in terms of influencing its functions. So these functions could be at molecular level, so those are biochemical. These functions could be at gross physiological level, where you are observing systems, how they are working in terms of breathing, respiratory, in terms of cardiovascular function, in terms of endocrine function, reproductive, all those systems. And so living organisms can be influenced by so many chemicals. The study of how these chemical substances affect the function of the body or living organisms is what we call pharmacology. And so, because of that knowledge, then we begin to use these chemical substances either to enhance how those physiological functions should take place, or how those biochemical processes should be enhanced, or we actually use that knowledge to understand whether the body is functioning well or not, what is called diagnosis. Or we can actually use that knowledge about these chemical substances and how they influence living organisms on trying to prevent diseases, trying to prevent different occurrences that would be maybe problematic in terms of biochemical or physiological processes. So that is basically the explanation of what pharmacology is all about. So a few definitions. We've already mentioned that pharmacology, therefore, is a study of how drugs exert their effects on living organisms. And so pharmacologists tend to study drugs in terms of which targets do they affect in the body. Do they just go and work by magic? No. So you discover that there will be different biochemical or physiological targets that we'll discuss, that pharmacologists use to describe what chemical substances impact on living organisms. So in most of the circumstances, the pharmacologist will be specialized in different parts or segments of pharmacology or branches. So they will specialize, and then you realize that most of these pharmacological specialties, drugs are also used like we said, as tools to understand whether the body is functioning well or not. So that is a diagnosis. And as you may guess, we have so many chemical substances in the body. If you studied chemistry, remember to join pharmacy. There are so many inorganic chemical substances, organic chemical substances. All those chemical substances can lead to the discovery of different chemicals we call drugs. So because of this, you find that we will have millions and millions of molecules that have been considered to be part of the medication that can be used, or even thousands and thousands of molecules that are approved for use in animals, human beings, and the rest of the sectors that use drugs, like agricultural sector. So, in summary, what are we saying pharmacology is the study of how drugs affect biological systems. So how do we study drugs? How do we study drugs is basically answering the question, what are the branches of pharmacology? So we study drugs by looking at how do they move in the body. So when we introduce a chemical substance in the body, how is it going to move? When we study that, that knowledge will give us insight of how the body tends to move this chemical substance in the body. Does it accept it? Does it break it down? Does it move? How does it move? How long does it take in the body? Because that can help us to make decisions whether this drug should be swallowed, applied on the body, not swallowed or injected, or inhaled, and all those decisions are based on how the drug moves in the body. We can also study these chemical substances or drugs in terms of pharmacology by understanding what they do to the body. So we'll be looking at where do they interact with the body, what are the targets, what sort of effect do we expect, what are the harmful, what are the beneficial effects, can we use these for diagnosis, for curation, can we use them for preventive or prophylaxis of problems. Then we also have another branch that I may need to highlight at this point, which focuses on the fact that, look, we may actually see all these, how the body is moving the drug in itself, how the drug is affecting the body. Then we can also look at and see that what we observe in one person may be different in another person. Some people, for example, you can give them the same drug that causes them, most people, to become drowsy, but some people, they don't even feel drowsy, while others, it's just a small dose and they are already feeling sleepy. So all those differences in the population and how they respond to medication or to drugs is very, very important in understanding and having the knowledge about different chemical substances we call drugs. So in this case, we have another branch. This branch is called pharmacogenomics. So basically, the primary branches of pharmacology are pharmacokinetics, looking at what the body does to the drug, pharmacodynamics, looking at what the drug does to the body, and pharmacogenomics, looking at the variability or the differences in reactions or the effects that are seen in the population when they are exposed to the same or similar chemical substance. We move and look at, in summary, therefore we are saying there are three branches of pharmacology that we need to focus on. We have pharmacokinetics, which is the study of what the body does to the drug. Pharmacodynamics is the study of what the drug does to the body. And pharmacogenomics, that is looking at what are the variations in response to these chemical substances.